Hi, this is Dr. B with Be Charmed with Dr. B, and today we're going to talk to Dr. Tolu Alugo, who is a practicing child psychiatrist in Canada, and she's going to tell us a little bit about herself. So, hello.
Hi, my name is Dr. Tolu Alugo. Like you've said, I'm a child and adolescent psychiatrist. I live in Atlantic, Canada. And yeah, I see kids up to the age of 19.
And that's in for those of us down in Mississippi, that is close to the New Brunswick area on the eastern coast of Canada, right?
Yes.
Okay, I'm so glad I got that right. But and so I think we've had some parallels in, I know that the medical systems are different in our different countries, but anxiety and depression and the need for treatment and care is the same. So, and I think we do have some parallels in our countries. I know here we are having a decrease in access of care. We just don't have enough physicians out there. There's not a lot of appointments available. Are you guys seeing that too?
Yes, we're very short-staffed. I mean, people are long wait times. Some communities have very little access to child and adolescent psychiatry. So other specialties are having to fill in the gaps in some way or the other.
So so for here, we can have a 6 to 9 month wait. Are you seeing something like that there too? Like that long?
Um, Luckily in our community, at least I would say maybe about 3 months, 3 to 4 months. It's not that bad yet.
Yeah. So if we needed to, so I'm a primary care physician, right? And I do see anxiety and depression, and sometimes it's at a level that we can treat here in the clinic, but sometimes they do need further help. But are there some things that people can do at home, like some cognitive behavior therapy techniques that you particularly like?
Well, yes. So I mean, cognitive behavior therapy is the first line treatment for anxiety or depression in adults and in children. So there are a few steps to CBT. So the
Mhm.
first step is psychoeducation, which is just understanding the illness. So
Right.
providing the patient or a family with information about anxiety or depression goes a long way in helping them to manage the symptoms. And then you want some strategies that can be practiced at home include looking at breathing exercises, relaxation exercises, progressive muscle relaxation, for example, helping a child or adolescent or even an adult to identify things that they can use to self-soothe. So if they're feeling anxious, what helps them to really slow down their breathing, to be less tense. If they're having a bad day, what kind of things can they do to improve their mood? Such as for depression, for example, having a schedule for your day. So getting up at a particular time, getting dressed, putting your makeup on,
Mhm.
exercising, healthy diet, planning to see a friend. So those are kind of basic strategies that everybody would benefit from.
Mhm.
And then there are some self-help tools available on the internet. I mean, different websites, some are linked to specific healthcare organizations who are developed by professionals, and people can access like CBT tools,
Mhm.
workbooks, and so on online. So, I mean, the only, I can think of a few, like there's Anxiety by Paul Stallard. It has a lot of workbooks around anxiety. There's the Substance Abuse and Mental Health Services Administration. I think it's based in the US. So
Okay.
SAMHSA. And they have lots of information, videos, um, resources for families as well. So, I mean, once you kind of do your research as to what's available locally, there's a lot of available help on the internet, as long as just make sure that they're professionals or,
Right.
you know,
Right. And I've seen some studies recently too that were talking about apps and internet sites that people could go to use internet-based or web-based CBT, and that they are successful. Evidence does prove that they do help.
Exactly, particularly in mild to moderate disorders.
Hmm.
So mild depression, where there's no self-harming, there's no thoughts of suicide, they're still functioning to some degree,
Hmm.
then CBT, self-help CBT, online CBT using an app is a good first step.
Hmm. Good. And I've had some patients too that, I see signs of anxiety and depression, and they don't want to have that diagnosis. I guess is the best way to say that. And so trying to talk them through, I think this really could be what's going on while you're ruling out other things, sometimes makes it a little, it creates a barrier to care in some cases as well. And so is there a way that you have found, and granted, by the time they get to you, they have that diagnosis, but is there a way that you have found to kind of transition people to, well, you may have anxiety. Why don't you look at these sites and see if they're helpful type thing? Is that useful?
That's useful. So kind of using what I would call like a solution focused approach. So
Mm-hmm.
not really being don't not being hung up on labels of
Right.
say you have major depressive disorder or just say you have this particular issue. You're too stressed to go to work, you're having to leave school early,
Mm-hmm.
you're not able to hang out with friends. Do you want some help with that? Maybe these strategies may help that particular problem. So that way you're focusing on the particular pain points
Mm-hmm.
and not on a label.
I like that. I like that a lot. People just don't like labels, and that's okay. I mean, you aren't your disease, right? You are your person. You are yourself, and you may have this issue, and that's okay, you know?
Exactly. Yeah.
Have you found, so I also have a lot of children that they don't want to take any type of stimulant medication. Their parents don't want them to take it. They have a diagnosis of ADD or ADHD. Have you found that there's any particular CBT options that are really good for this population?
Well, the first line treatment for ADHD, usually is non-pharmaceutical
Hmm.
options.
I agree
So
with
you
you.
so you want to try other things first, and
Hmm.
then if they are not successful, the child is not still not doing as well as they could at school, or it's impacting their functioning, then you think of medication. So things like using reminders,
Hmm.
setting an alarm, having a list, visual schedules, those kind of things. If a child is distracted in class, wearing noise canceling headphones, sometimes having a paper weight on their book, so they're sitting still. There are fidget cushions,
Hmm.
fidget spinners. So there's just so many different tools that you can employ first.
Hmm.
You may find that those are good enough at some points, but if that is not enough, then medication becomes the next layer. But
Hmm.
I always say, even for kids on medication, it's still a life skill to be able to use all those strategies, like writing a list, like setting an alarm, like reminding yourself, like having a checklist and stuff like that.
I like that a lot. I don't like a lot of medication, and I was at a pediatric CME, continuing medical education lecture before COVID, and the pediatrician speaking was saying how stimulants were first line. He's like, don't even try to do anything else. Just start with stimulants, and then you can add stuff. And I was like, that is wrong. It is just wrong. We shouldn't just medicate with if somebody has a behavior that they can modify without, because CBT doesn't have side effects, but medication certainly does.
I mean, for mild symptoms where they're not impacting functioning. So, for example, you're seeing a child who can't sit still long enough to listen to the
Mm-hmm.
teacher, who's been asked to cut down their days to half of the school day, who cannot be left alone at home at maybe a reasonable age because of the dangers.
Right.
Then you're thinking,
Then
medication.
you do need
So
something
you
else.
so
Yeah,
you have to really look at the entire picture
that's right.
and look at the pros and cons and balance the risks versus benefits.
Yeah, I agree with you 100%. Have you found that caffeine helps? Like if they drink coffee or even soda, even though it's not the most healthy?
On the other, I don't know, for some reason, caffeine may actually worsen things.
Does it?
Caffeine
Okay.
and soda. I mean, anecdotally, a lot of kids I see who are drinking a lot of Red Bull and a lot
Oh
of
yeah, well that
sugar
would worsen it. Yeah.
may actually be more hyperactive, and so it's kind of counterintuitive what you're treating with stimulants. But then I'm not sure whether it's just the science behind how they formulated, but a lot of the kids with caffeine, there's a lot more challenges. They may be able to focus, but
Mhm.
they just may feel jittery and unable to settle. So it kind of varies depending on.
I guess that's another case by case. Hey, if that kid actually settles with coffee, then great. If they don't, then yeah, no, don't use that.
Exactly, yeah.
Um, besides access to care, what do you think, what concerns do you have with psychiatry that you see might be an issue in the next 6 to 12 months?
I think it's just, I mean, access to care is the main thing.
Yeah.
So and then with the pandemic, there's been such a change in our lives that we're seeing a huge increase in numbers. So, number of people with anxiety disorders have increased, people with depression. A
Hmm.
lot of kids are not used to socializing any longer. They've been stuck at
Right.
home. So now having to get back into society, having people call to the house, I've seen kids who now don't want extended family to visit because they're thinking they're bringing germs. So I think a lot of people presenting, I think there'll just be an increase in people needing assessments where the supply of psychiatrists is limited. The demand um, is really outpassing the supply.
Do you think if there was a way to re-socialize children in particular that wasn't school, and I'm just coming up with something here. I don't know what that would be. Sports in school is a good way to get people to engage with each other, group activities like that. But you do have to counteract the whole fear of catching something or spreading something. So is there a nice compromise between those two things that you have seen?
Well, even family gatherings, getting birthday parties,
Yeah,
going to visit the cousins, the grandparents, neighborhood gatherings, like start small, having friends over, if just one family, and then gradually introducing larger gatherings,
yeah.
those kind of things, going to the library, your public library.
Hmm.
You already mentioned sporting activities, but I think, bringing them to the grocery store with you when you're doing your groceries, it they may delay you, they may want to buy everything on the shelf, but
That's
it
right.
also helps them be out and about.
Yeah. Yeah. I think there's some adults that are suffering from that too, actually. People got so used to being home and secluded and what they considered to be safe that it's hard to get out there and try to live a normal life.
And you know what? I mean, having to socialize is stressful. You have to kind of think about how you look and make sure you're dressed
Mhm.
appropriately and what you say. So yeah, it
Yeah.
can be stressful. But if you're in your house and you're ordering stuff online and nobody's visiting, you can get into a routine that you get so comfortable with.
That's true. And that was true before COVID. I know I wasn't one that liked to go to parties or anything like that, right? We have a friend, Dr. Una, that says she's an introverted introvert, and I definitely relate to that. I'm okay one-on-one, but and so COVID was a nice excuse to kind of just hide away, right? And so to try to come back has been a little difficult, even without a diagnosis of something like anxiety or depression or something like that. Um, so to change topics really quickly, um, there was a recent article, and I don't know if you get the American Medical Association journal. I doubt it because AMA, right? But there was a recent article that was discussing melatonin and how we have seen an increase of melatonin use in our population, particularly in children, and the concerns that the American Psychiatric Association had for long-term effects of melatonin. And I didn't know if you guys have that same thing in Canada. Do you guys use melatonin quite a bit for a natural way to help with sleep?
Yes, we do prescribe melatonin quite a bit. And I know, I mean, I would agree that there are concerns because nobody knows the long-term effects
Mhm.
of this medication. I'm not sure it has been studied that,
That
for that
much.
length of time or that closely. However, um, melatonin is a naturally occurring chemical produced by the pineal gland, as you know.
Right.
But it's important that we should realize that it's not harmless. It should still be monitored
Mm.
and supervised by an adult. There are many cases of kids ingesting melatonin because they think they're just gummies or sweets.
Yeah.
And so that's one concern. Also, in the short term, you might find that if it's given at the wrong end of the day or too late in the night, you might have drowsiness the next morning.
Mhm.
Some people have had headaches or dizziness on it, but it can be used to advance the bedtime. So, for example, if it's given a few hours before bedtime, it may help the child fall asleep quicker. So, I mean, so it just depends on what time of the day you're giving it, how strong a dose.
Mhm.
But the reminder is it shouldn't be like a permanent long term medication. it should be supervised,
Yeah,
and the need for it should be reassessed again and again.
definitely.
Like I said, we don't know the long-term effects of it yet.
And it definitely should be combined with sleep hygiene, you know.
Oh, definitely. Yeah.
Yeah, and I think sometimes that's missed, you know, especially when people self-treat with over-the-counter type of options there. So yeah. Is there anything else that you would like to discuss or talk about in the psychiatric field? Anything major that you know of that's a big difference between our two countries? Because I think this
Um,
is so cool to talk to someone that practices in a whole different country, you know?
I think they're really similar. I mean our
They really
populations are
are.
very similar. So it's
Yeah.
really the same things. Anxiety in children is anxiety, depression, a lot of ADHD that we already spoke about, autism
Mhm.
spectrum disorders. I'm not sure what kind of services you have.
Yeah.
I mean, I think you guys have a lot more services because you're a bigger country and some communities are better resourced. But that's one area that I find can be very, very under-resourced and stretched
Yeah.
because we just
Mental
don't have
health.
the personnel or the facilities to deal with these severely autistic kids.
Yeah, and I was just gonna say I did notice here that it seems like the kids that have autism actually did much better during the COVID lockdown times
Mhm.
than they do normally. And I think it's just because their schedule was so scheduled, you know?
Exactly, yeah. And there was no social interaction, there were no social
Right.
demands on them. So
Nothing
yeah.
to take them out of their comfort zone the way
Mhm.
normal life does. So a lot of our autistic kids actually did quite well.
Yeah, true. That's true.
Yeah.
Yeah.
So, but I want to thank you for taking the time to talk to us today. I've really enjoyed it, and I hope that we can come together again and have more conversations about mental health and, you know, ways that maybe we can come up to help people.
Exactly. That would be fantastic. I mean, we're here to serve and we just want to make things better for the populations that we serve.
That's right. Thank you so much.
Thank you for having me.
All right.